Hey everybody, good to see you all. This is the COVID-19 educational session for administrators, faculty, and staff in the Chaffey College Athletic Department. My name's Nate Aiken. I have with me Brashit Tarmani. Both of us are the department athletic trainers, so we are in charge of anything sports medicine related, and COVID-19 that falls under that. And so we'll be walking you through just some of the basic facts and educational material around COVID-19 to make sure that everybody not only knows what it is, but then also is able to educate their student athletes on different things such as prevention, transmission, what to do if you have it, all of that stuff. So much of it is stuff that you may have heard already, but just bear with us and we will get going with that, okay? So as I said, COVID-19 educational session. This PowerPoint will be provided to you as well. So an overview of the presentation. We're going to cover what COVID-19 is, what some prevention tips are, some myth busters, things that people commonly believe that aren't necessarily true, treatment for the disease, responsibility to the team, and then also the fluidity of the situation, okay? So COVID-19, coronaviruses are a large family of viruses common in both people and animals. Most common coronaviruses cause the common cold in humans. COVID-19, though, is caused by a virus that has been named SARS-CoV-2, which is in the same family of viruses as SARS and MERS. For those of you that remember those, that was not so long ago. COVID-19 is a respiratory disease that is being spread by a new coronavirus that emerged in 2019. It affects both the upper and lower respiratory tract. It's a virus, meaning that there's no medication or drug to cure COVID-19. It literally is just kind of time and relief of symptoms that helps it. So medication can only be used to treat symptoms. Some of the signs and symptoms associated with COVID-19. So these are the most common signs and symptoms, but they're not the only ones that present with the illness. So first is a cough, fever, repeated shaking with chills, headaches, new loss of taste or smell, severe vomiting, shortness of breath, chills, muscle pain, sore throat, loss of taste, and diarrhea. Some of the complications that can arise from COVID-19 include pretty severe things like acute respiratory failure, acute respiratory distress syndrome, viral pneumonia, acute kidney injury, acute liver injury, secondary viral and bacterial infection, septic shock, abnormal blood clots, which can also lead to pulmonary embolisms or stroke as well. So when to seek medical attention with COVID-19, you want to look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. When we're on campus, that'll be Brash and I. But if someone starts experiencing any of these symptoms outside of practice or games or anything, they'll want to seek emergency medical care through EMS, a family member taking them to the hospital, etc. So this is definitely not an all-inclusive list of symptoms, but trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and then bluish lips or face. So any of those indicates a severe case that should be seen. So for transmission, person-to-person transmission is very, very common between people who are in close contact with one another. This is spread typically by respiratory droplets that are produced when an infected person coughs, sneezes, talks, sings, etc. Droplets can land in the mouths or noses of people who are nearby, or possibly can be spread by individuals who are not showing symptoms, okay? And then you've also got contact spread, which is by touching a surface or object that the virus is on, and then touching your own mouth, nose, eyes. The amount of time that the virus can live on surfaces depends on the material of the surface. So on plastic or stainless steel, it can live for up to 72 hours. On something like copper, it can be less than 4 hours. And then on cardboard, it'll be less than about 24 hours. So definitely not a rule of thumb, but just a general principle there. So prevention, what we want to do is we want to avoid large events and mass gatherings. This is common knowledge, with many mass gatherings and large events being canceled this past year. We want to avoid close contact, or in other words, about 6 feet with sick individuals. This is called social distancing, which all of us are familiar with. We want to wash hands with soap and water for 20 seconds or use an alcohol-based hand sanitizer made with at least 60% alcohol. You want to avoid touching your mouth, eyes, and nose unless you've cleansed your hands recently. Avoid sharing personal items. So for example, water bottles, we never want to share water bottles, even in normal times, but all the more so now. We want to clean and disinfect high touch surfaces as needed. So that includes tables, doorknobs, your desk, sports equipment. Use approved disinfectants. So there's a list of those that we can get you if you need that. And then you want to avoid going to work, school, or gatherings if you are sick, and encourage student athletes to do the same. So this is definitely not the time to tell someone to tough it out if they are feeling any of the symptoms that we listed earlier. If they are, it's best to just have them stay home. And especially since the summer in particular won't be a competitive season, just have them stay home. It's not worth the potential spread to your team having multiple people out for a while. So we've got a little video here. This is what you need to know about hand washing. There's no sound, so I'll kind of narrate it as we go. It's from the CDC. You want to use soap and water to get rid of germs, in this case, viruses. You want to use either warm or cold water as long as it's been filtered or clean. Any kind of soap is better than nothing. The soap doesn't have to be antibacterial. Plain soap and water works just fine. If you don't have soap, but you have access to water, water is more than enough to get the bulk of things off. When hands are not visibly dirty, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. So worst case scenario, that's what you do. Scrubbing your hands for at least 20 seconds is most effective. Germs like to hide under fingernails, so make sure you just kind of peel the skin back a little bit under the fingernails, get some water and soap in there, or hand sanitizer. If you're using a towel, whether it's paper towel or fabric, make sure that that's clean before you use it to dry. Already covered this a little bit, but 60% alcohol-based hand sanitizers are typically your best bet if there's no water and soap available. Always wash your hands before eating or after using the restroom. So this is not only protecting yourself, but it's also protecting others by just keeping clean as often as you can. That's the video. All right. Brosh, you're up.
Thank you, Nate. I appreciate it. As Nate mentioned, my name is Brosh Tarmani. I'm the other athletic trainer at Chaffey College, and I'll be picking up where he left off. So we're going to cover prevention, okay? So how to properly wear a face mask. What you want to do is make sure the correct side of the face mask is pointing outwards. You want to have the strings or the bands behind your ears, and you want to make sure the metallic band is pressed against your nose to take the shape of your nose, and make sure your nose and mouth is both covered. You don't want to have your just nose uncovered. You want to make sure they're both properly covered. And of course, wearing a mask, and avoid touching the face mask while you're wearing it. And if you do touch it, make sure to wash your hands. And when you are about to take the face mask off, when you're not around people, use the string behind your ears to take off the mask. And then, of course, wash your hands after doing so. So COVID-19 versus the flu and your common allergies. So coronavirus, you can have fever, cough, shortness of breath, or difficulty breathing. Symptoms may appear 2 to 14 days after exposure, whereas to the flu, you have fever, cough, muscle aches, fatigue and weakness, chills and sweats, congestion and sore throat. And then your allergies, you have the sneezing, itchy nose or eyes, or the roof of the mouth, runny, stuffy nose, and watery, red, and swollen eyes. So Mythbuster, there are currently no drugs licensed for treatment or prevention of COVID-19. Adding pepper to your soup or other meals does not prevent or cure COVID-19. COVID-19 is not transmitted through houseflies or mosquitoes. Spraying and introducing bleach or other disinfectants into your body will not protect you against COVID-19. Drinking methanol, ethanol, or bleach does not prevent or cure COVID-19. Cold weather and snow cannot kill the new coronavirus, and high temperatures or humid environment does not prevent the spread of COVID-19. And then drinking alcohol will not protect you against COVID-19 either. So as far as treatment goes, what if you get sick? So stay home except to get medical care. Most people have mild illnesses and can recover at home. Do not leave unless it is to seek medical care. Avoid public areas. Get rest and stay hydrated. Take over-the-counter medications such as acetaminophen to help with the symptoms. Stay in touch with your doctor or athletic trainer. Avoid public transportation. And of course, separate yourself from others as much as possible. Stay in a specific room and away from people and pets in your home. If you must be around other people, make sure to wear a face covering. Treatment, so monitor your symptoms, right? Keep track of all your symptoms and be aware if they worsen. If your symptoms worsen or you believe you have an emergency warning sign, seek medical attention right away. These are some of the emergency warning signs or so-called red flags: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to awake or stay awake, and bluish lips or face. And personal responsibility. You want to communicate with medical staff prior to going onto campus. Operating procedures have changed, so this will affect availability, scheduling, as well as the facility use. Understand your role and procedures in an emergency, whether it's COVID or non-COVID related, and then personal protective equipment acquiring. Know the location and appropriate use of the equipment, and then identify an isolation area. Prevention will only happen with your help. So you may be required to perform new tasks and responsibilities as well. So responsibility to your team. You want to educate, right? So present accurate and up-to-date information to your athletes during the first orientation meeting and or have them view the student athlete online presentation, which we have provided. Go over prevention techniques and mandate that they will be followed. Discuss responsibility that each student athlete has to each other, the athletic training staff, and the coaching staff, as well as your responsibility to the team. So provide a safe environment to train and compete. What can be changed about meetings, viewing film? This can be virtual, possibly virtual. Training and conditioning, if the weight room is off limits, you can do this outside. Practice times, activity and drills also can be modified as well. So are the facilities, venues being maintained and disinfected according to new standards, and any shared equipment needs to be cleaned appropriately. So more on responsibility to your team. Communication with an athletic trainer about signs and symptoms prior to getting on campus, following institution policies. So training, practice, and competition participation. You want to encourage and enforce the stay-at-home standard for all student athletes and staff when experiencing any symptoms. Foster an open and honest environment that doesn't put down student athletes for staying home. And of course, the mental health is an important part. Be a resource for your student athletes' mental well-being. In case of an emergency, roles and responsibilities. So updated emergency action plans regarding COVID precautions, use of personal protective equipment at onset or of activating EAP. And then what to do if your student athlete gets sick. You want to be honest, you want to act timely, and then isolate per institution policy, which can be different at each venue. And then fluidity of the situation, right? So remember, COVID-19 is an illness caused by a novel coronavirus. New information is constantly emerging and guidelines are continuously changing. And because of that, education will be ongoing. So stay up to date. You can visit the Center of Disease Control website, cdc.gov, or the World Health Organization website, who.int. And the next few slides are some resources that you may refer back to if you have any questions, as well as the references we have added to the slides as well. So thank you for watching. Nate, you want to add anything to that?
Nope, that's it. Yeah, make sure that you view this presentation in its entirety and make sure that you're enforcing your student athletes going through the student athlete presentation as well, which we'll send to you. So hope that you all are doing well, and we're excited to get back. Go Panthers.